UNICEF has released data detailing the number of children who've missed routine vaccinations during the COVID-19 pandemic in Africa. Immunization helps protect children from a number of killer diseases, polio, measles, diphtheria, tuberculosis, and meningitis, among others. Joining us now is Christine Muhigana, who is a UNICEF South African representative. Christine, thank you for making time for us. So according to this research, 1 in 5 children in South Africa are under-immunized, according to this report. What exactly is behind this alarming trend?
Yes, good evening, and thank you for giving us the opportunity to talk about this global report. It's actually a report that compiles data that come from various countries, all countries actually around the world. And we put together the data that comes from national departments of health regarding the immunization, the performance of the immunization programs in the country. So as you said, 1 in 5 children in South Africa are not optimally immunized, which means that they may be exposed to the immunization program at some point, but for some reason or another, there is no follow-up to the immunization coverage. Or, and very concerning, we also have children in this country, 104,000 of them, who are actually never immunized. The reasons why this is happening are varied. Some of it has to do with access to the immunization services, geographic access, time to come to the services. Some of them have to do with hesitancy, people not believing in the efficacy or in the importance of vaccine. We see through this report that in South Africa actually we have a decrease in the number of people who feel that immunizing a child against preventable diseases is actually less important. 30% less people over a couple of period of a couple of years actually who feel that it's not that important. The Covid-19 pandemic and everything related to the vaccination program against the virus of Covid-19 had also something to do with that.
What does the report say about the trends globally?
So it's unfortunately a global trend. What we see here in South Africa is not unique. It's not specific. So we have actually globally a stunning number of 48 million children who missed out entirely on vaccination between 2019 and 2021. And the number that I cited for South Africa, 104,000, so is a portion of that global number. And what we see or what we observe here in South Africa, the hesitancy, the issues of the performance of the health system, the availability of vaccines, and then so that's the supply side, but also on the demand side, families, mothers, parents not always being able to go to the health centers, to the clinics where the vaccines are available to have their children immunized. So this is something that's unfortunately happening around the world. It's exacerbated in countries where there is conflict or war or poverty, where they have governance issues or where the health system is not as robust as it is, for example, here in South Africa. But as we see, it is also a problem here in South Africa where we have a quite resilient health system, but which is encountering challenges also to get the immunization program running in an optimal and satisfactory manner.
Yeah, I spoke to a representative from the South African National Health Department who was confirming earlier that at some point in this country, we used to have a strong children's vaccination program, right? The rate of immunization was high and the programs were successful. But what you are telling us now as to what the trend is, not only in South Africa but globally, is quite concerning. So what will nation states do? What will the World Health Organization and even yourselves and UNICEF, what needs to be done in order to reverse this current trend?
So what needs to be done is actually to continue the mobilization that a country such as South Africa is conducting. So there is strong leadership from the Department of Health to make sure that there are catch-up campaigns, catch-up exercises to get children to come to the health services for vaccines, looking in a granular way at the issues that are behind, the decline in immunization. In some instances, it is stockouts of vaccines in certain areas. We also are here to support the government of South Africa, the system, in making sure that the cold chain system is actually strong enough so that the vaccines can be shipped and can be stored where they need to be close to the vaccination sites. We're also working with in a creative and innovative way in outreach programs, which include having a truck, a mobile device, multimedia, which goes out to communities to talk about the importance of vaccines, to make sure that communities, families, parents know where the services are available. And we also do it in a way that strengthens the system, the primary health care system, and also integrates. So it's just not about coming to a health facility to immunize a child, but it's also to get information about the nutritional services or importance of in caring for children. It's about birth registration. It's about a whole package of child health that we want to promote through this highlight on the importance of vaccination of children in South Africa, in Africa, and around the world.
All right. Christine Muhigana, UNICEF South African representative, thank you so much for making time for us.